Well, the oral presentation I'm going to be talking tomorrow morning is on the second validation of the EBMT early relapse score. In 2023, we published our report and we presented the early relapse score, which identifies the functional high-risk myeloma, and the score includes three parameters. One is related to the patient, one is to the disease, and the third is to the treatment. So ISS, performance status prior to transplant, and response to induction. So these three parameters, when combined together, they make a score which can predict the relapse risk within 12 months from transplant, or in other words, like 18 months from diagnosis, is predicting relapse in 58% of patients if they achieve score 4. So the score has 5 tiers from 0 to score 4, and after publishing this data, we received some criticism based on the fact that these patients, well, actually it was based on a huge number of patients, more than 7,000. They were treated before 2017, so they had received old induction regimens. The question was, in the era of more advanced induction regimens, is the score still valid? And also another caveat was the lack of analysis of cytogenetics, because in that part of the study there was half of the patients with missing cytogenetics. Now, with more recent data, after 2020 until 2022, we have 8,000 patients who were analyzed, including a broader age range and all induction regimens, more recent ones, and also with more a wider coverage of conditioning regimens. It is surprising to see that we still see the same frequency of high risk for early relapse, score 3 and 4, that adds up to about 10%, and the risk of early relapse is about 42% in overall. But when we divide the patients according to their cytogenetic risk, the early relapse risk goes up to 62% in high-risk patients. But with standard risk, it goes down to 33% for score 4 patients. So in this way, we can say that a simple score, which does not include any molecular gene expression profiling, which is not widely applicable, ISS, performance status, and response to induction prior to transplant, with the use of these three parameters, you can predict early relapse. And this may enable patients to change treatment or to integrate more advanced treatments such as CAR T therapy for those who are prone to relapse and before major organ failure develops.